The cardiac cycle refers to all the mechanical events during one systole and one diastole. We begin by discussing the events in the left heart, starting with atrial contraction. The process in the left heart is essentially similar to that in the right heart. When we talk about the left heart, we mean what is happening simultaneously in these three chambers: the LA, left atrium, LV, left ventricle, and the aorta. In this diagram, atrial contraction. The first phase is left atrial contraction, meaning that the mitral valve must be open. At this point, the aortic valve remains closed because the pressure in the aorta is higher than in the ventricle. When the left atrium contracts, there is communication between the LA and LV, but not between the LV and the aorta. The input system of the LV is functioning, but the output system is not. By the time the LA starts contracting, about 80% of ventricular filling has already occurred passively. Atrial contraction adds the final 20%, meaning atrial contraction isn't required for the majority of ventricular filling. Even in individuals with atrial dysfunction, 80% of ventricular filling will still occur passively. However, atrial contraction becomes more important in people who are physically active, especially during exercise. During atrial contraction, atrial pressure rises slightly, creating the A wave, a pressure wave that occurs in both sides of the heart. As the atrium contracts and pressure increases, the mitral valve must remain open so that the atrial pressure can transfer to the ventricle. Before atrial contraction, ventricular pressure is close to zero, but it starts to increase slightly as the atrium pushes the last bit of blood into the ventricle. Once atrial contraction is complete, the action potential passes to the ventricle via the AV node, initiating the next phase. Ventricular contraction. After atrial contraction, ventricular contraction begins. The atrium relaxes and depolarization passes from the LA to the LV, causing ventricular contraction. In this phase, the ventricle is filled with blood, and the aortic valve remains closed as the pressure here is around 80 mmHg. As soon as the ventricular pressure exceeds that of the atrium, about 5 mmHg, blood attempts to flow back, leading to the closure of the mitral valve. This closure produces the first heart sound, S1. S1 is heard when the mitral valve, on the left side, or the tricuspid valve, on the right side, closes. The ventricle continues to contract in a closed chamber as both the mitral valve and aortic valve are closed. This phase is known as isovolumetric contraction, where no blood leaves the ventricle or enters the aorta. The volume inside the ventricle remains constant while the pressure rises. During this phase, the pressure in the atrium rises slightly due to the bulging of the mitral valve, producing the C wave. Meanwhile, venous blood from the lungs is accumulating in the atrium, which acts as a reservoir, causing a gradual increase in atrial pressure. As soon as the ventricular pressure exceeds aortic pressure, the aortic valve opens. This marks the end of the isovolumetric phase and the beginning of rapid ejection, where blood is ejected from the ventricle into the aorta. As the ventricle contracts further, aortic pressure rises to about 120 mmHg, and blood continues to flow rapidly into the aorta. The aorta stretches to accommodate the increased blood volume due to its elasticity. Meanwhile, the atrium continues to act as a reservoir for venous blood returning from the lungs, and the V wave is produced as atrial pressure gradually increases. This phase is called the rapid ventricular ejection phase. As the ejection phase progresses, the ejection rate slows, marking the beginning of the slow ventricular ejection phase. The mitral valve remains closed and the atrium continues to act as a reservoir. Ventricular pressure begins to fall, and while the aortic valve remains open, the ejection rate decreases. The pressure in the ventricle and aorta starts to drop, and the elastic walls of the aorta help push blood into the peripheral arteries, allowing for continued, though slower, ejection. Ventricular relaxation, diastolic phase. As the left ventricle begins to relax, the diastolic phase starts and ventricular pressure rapidly decreases. The mitral valve remains closed and the atrium continues to act as a reservoir, with the V wave rising slightly. As ventricular pressure drops, blood in the aorta tries to flow back into the ventricle. However, the aortic valve closes, disconnecting the ventricle and aorta as independent chambers. The ventricle continues to relax in a closed system, leading to isovolumetric relaxation. Once the ventricular pressure drops below atrial pressure, the mitral valve opens and blood rapidly fills the ventricle, marking the rapid ventricular filling phase, which occurs without atrial contraction and is passive. In the subsequent phase, the mitral valve remains open and venous blood from the lungs continues to flow into the ventricle. The atrium no longer acts as a reservoir and instead serves as a passageway, leading to slow, passive ventricular filling or diastasis. After this, the SA node fires and the next cycle begins with atrial contraction. In summary, the cardiac cycle consists of atrial systole, contraction, followed by atrial diastole, and ventricular systole, contraction, where the atrium fills with venous blood, and finally, ventricular diastole. When the heart beats at 72 BPM, atrial systole lasts approximately 0.1 seconds, while atrial diastole is significantly longer. Ventricular systole lasts around 0.3 seconds, while ventricular diastole lasts about 0.5 seconds. Heart sounds. When the left ventricle contracts and ventricular pressure rises, the mitral valve closes, producing the first heart sound, S1. During aortic valve opening, no sound is heard in a healthy heart. Sounds during valve opening indicate valve dysfunction. As the ventricle relaxes and ventricular pressure falls, the aortic and pulmonary valves close, producing the second heart sound, S2. S3, sometimes heard during rapid ventricular filling in young individuals or during exercise, can be pathological. In hypertrophic conditions, atrial contraction against a hypertrophied ventricle may produce S4, a typically pathological sound. While this description focuses on the left heart, the same phases occur in the right heart, though with lower pressures. In the aorta, pressures range from 80 to 120 mmHg, while in the pulmonary artery, they range from 8 to 15 mmHg. Left ventricular pressures vary from 0 to 120 mmHg, while right ventricular pressures range from 0 to 25 mmHg.